Why do the most complicated orthodontic cases on social media get the most attention, while simple and effective treatments remain almost invisible? And are complexity and control really the same thing? Or is this where ego quietly replaces efficiency? My name is Dr. Martin Baxmann, and welcome to the Lean Orthodontics podcast. Today's episode is a short but important reflection on social media and orthodontics, and on a contrast I observe almost every single day: lean orthodontics versus what I like to call ego orthodontics. Many of us begin the morning by scrolling through Instagram, Facebook, or other platforms, and suddenly valuable minutes are gone. But that alone is not the real issue. What truly surprises me is the type of orthodontic content that is rewarded with attention, likes, and admiration. Lean orthodontics stands for efficiency, clarity, and reproducibility. It focuses on doing what is necessary and consciously leaving out everything that is not. Treatments are transparent, sustainable, and based on solid diagnosis combined with well-understood mechanics. Yet on social media, we frequently see the opposite approach being celebrated: extremely complex constructions, multiple loop arches, mini implants combined with sectional wires, and elaborate mechanics are presented as proof of control, sophistication, and expertise. The irony is that many of these constructions are used to solve problems that could be managed far more simply and reliably. There is a widespread belief that more mechanics automatically mean more control. In reality, the opposite is often true. Complexity does not reduce variability, it increases it. When we bend highly complicated arch wires or design intricate mechanical systems, we may achieve a result once. But reproducing that same result again, let alone teaching it to someone else, is extraordinarily difficult. This is what we describe as intra-rater and inter-rater variability. Even when the same clinician repeats the same procedure, the outcome is never identical. When different clinicians try to copy what they saw online, the variability increases even further. We are already familiar with this problem from diagnostics. If several orthodontists trace the same cephalometric landmark, the results will differ. Even if one orthodontist traces the same landmark multiple times, the measurements will not be identical. This alone should make us cautious about blindly copying complex biomechanical constructions from social media posts without fully understanding their limitations. The same applies to biomechanics itself. Perfectly calculated forces, precisely drawn centers of resistance, and mathematically exact angles may look impressive on paper, but clinically they remain approximations. Teeth move in 3 dimensions, and they move over time. Each tooth has its own dynamic coordinate system, influenced by anatomy, biology, and ongoing treatment changes. The idea that extreme mathematical precision guarantees perfect clinical outcomes is, quite simply, an illusion. Personally, I value elegance, simplicity, and intelligence. In music, a melody is often powerful because it is immediately understandable. The same applies to orthodontics. A simple, well-designed system that works consistently is far more impressive than a spectacular construction that is difficult to reproduce, hard to teach, and impossible to standardize. This is my invitation to you. Don't be dazzled by overly complex treatments on social media. Focus instead on achieving consistently high-quality results in your own practice. Build systems that are reliable, teachable, and repeatable. Understand clearly which patients require which approach, which tools you genuinely need, and how to apply them efficiently and responsibly. Simplicity does not mean oversimplification. It means clarity, scientific thinking, and conscious decision-making. Read beyond headlines. Look into methods, limitations, and biases. Question what you see, especially when it looks too perfect to be true. If this episode gave you something to reflect on, then it has done exactly what it was meant to do. Subscribe to the podcast, share it with colleagues, and feel free to leave a comment, whether you agree or disagree. Till next time, stay focused, stay curious, and keep orthodontics lean.